All right, so we'll quickly look at the clinical evaluation of lower GI bleeding. All right, so for lower GI bleeding, for the clinical evaluation, this is just trying to lay emphasis on the physical examination and history taken, which you have to do to the patients that have this lower GI bleeding. All right, because it's laying emphasis on this concept because it's from the history taken and physical examination that you get to actually you get the informations that you need. All right, so these are the various causes of what lower gastrointestinal tract bleeding. We have about 13 causes here. We pause to actually look at it. So for the evaluation, so after you have resuscitated the patient, you are basically um resuscitate, like you have stabilized the patient. Okay, all right, you now take a detailed history and you now perform a thorough physical examination of the patient. Okay, so now you should know the character of bleeding. All right, so you should know the onset of the bleeding. They should tell you when the bleeding actually started, right? Tell you when the bleeding started. They'll talk about the volume. All right, like ask them like, okay, when you were bleeding, how much was it? Okay, then you should also know the color of the bleeding. Was the bleeding frank red or was the bleeding black? Right, to basically help you know if this bleeding is coming from the lower gastrointestinal tract or the upper gastrointestinal tract. Okay, so hematochezia, right? Hematochezia, melena, and greenish character of stool. Right, so you should just know the color of the stool. Right, then hematochezia, that's frank blood, right? Melena, that's what dark blood in this thing in the stool. All right, so history can provide clue to diagnosis, right? So for the elderly people, you can be suspecting things like what angiodysplasia, you can be suspecting divascular disease, you can be suspecting ischemic colitis, which is inflammation of the colon. But this inflammation of the colon is because there is the blood supply is blocked or totally blocked or narrowed. Okay, then you can also be suspecting what cancer. That's for the elderly. Then for young people, you can be suspecting things like what peptic ulcer, varices, Meckel's diverticulum, right? Like problem with the Meckel's diverticulum, right? Then comorbidity, condition, and drug history should also be taken. Comorbidities, like okay, you just try to find out like okay, apart from this, have you ever been sick again? All right. So the patient should give you a rundown of their past medical history. Okay. Then also you take note of family history and all the stuff, right? So all that will now collectively be your clinical evaluation of a patient that has lower gastrointestinal tract bleeding.